The following program is a Town of Colony television production of the William K. Sanford Town Library.
Hi, welcome to the latest edition of Mental Health Now. I'm your host, Matthew Shapiro from the National Alliance on Mental Illness New York State, or NAMI New York State. Before we start our show, I want to acknowledge, on our last episode titled Find Help, Find Hope, we discussed the NAMI Ribbon Awareness campaign that took place during May, which was Mental Health Awareness Month. And I really want to thank all the businesses throughout the Capital Region who have participated in the campaign and really have helped us raise mental health awareness around the region. As we say here, hope starts with you, and thank you for your participation. So in today's episode, we're going to be talking about one of the most important issues impacting the delivery of mental health. It's also one of the more misunderstood elements of mental health care, and that's the assisted outpatient treatment program. Here in New York, we have what's called Kendra's Law, which was the country's first assisted outpatient treatment. It's also the country's most successful. States around the country have really used this program as a model. And what it's been able to do is make sure that people with the most serious types of mental illness get the care that they need outside the hospital setting so they can recover in the community with the goal of generating the best outcomes and keeping them out of the hospital, out of jail and prisons, and off the streets and homeless. So it's very important. And while there's some differing opinions on it, the one thing that can't be argued are the facts and the success of the program. Many studies have been done on the program, and it's been shown to reduce homelessness, suicide attempts, hospitalizations, and incarceration. So it's been a very successful program, though misunderstood. So our goal today is to shed some light on the issue, to separate the facts from the myths, and demonstrate that the program can have an impactful influence on people's life and their recovery. So I'm so honored today to be joined by my two guests, Ramona Bartholomew from the Albany County Department of Mental Health, and she's the Community Mental Health and Criminal Justice Unit Coordinator, as well as coordinating the county's assisted outpatient treatment program. And we're very lucky to be joined by Christine Dwyer, who's been through an AOT process, and she's going to talk about a little about her story of recovery and how AOT played a part in that. So welcome, both of you. I'm so happy to have you here today.
Thank you. Thank you.
So Ramona, I'm going to start with you. We'll go over a little of the nuts and bolts of the program. Can you explain to our viewers what AOT is?
AOT is assisted outpatient treatment, and it is a court order that a judge has signed mandating an individual who has a history of 2 or more admissions in the past 3 years, who has been non-compliant with medications and treatment, and as a result was admitted to the hospital or incarcerated, was not likely to remain safely in the community without a court order, not likely to participate in treatment on a voluntary basis, and evidence was presented to the judge to say that this person could benefit from a court order, and a court order is signed, services are put in place outlined in the AOT treatment plan, and hopefully get the person into treatment, into support services, and back on track so that they remain out of the hospital or out of incarceration.
Right, and that's really the goal of the program, is treat people in the community. Let's keep them out of the hospital setting, and obviously, ultimately out of jails and off the streets, as I said. So it's very important. Now, when you said a court order, that's a civil court, correct?
Yes.
Not a criminal court.
Right.
Now, let's say I have a friend or a loved one who I'm very concerned about, has been in the hospital. As our viewers know, I talk about my story a lot. My mother has a severe borderline personality disorder, so luckily I've never had to call on. But if we did, what would be that process? What would be the steps to take on?
Well, every county that participates with AOT has a process. First, a referral would be submitted to the county AOT coordinator, and on our Albany County's AOT referral form, it indicates a diagnosis, a number of admissions, dates of those admissions, the facilities, address, any involved family members is on the referral form, and then we request information from the facilities. We try to get a release of information, or we need to get a release of information from the client to receive that information. Once we receive records, we review them to see whether or not it documents that these admissions or incarcerations or acts of self-harm or harm to others were a result of noncompliance with medication or treatment. And if we see that there is documentation around that, we can then set up an evaluation with a physician who reviews that record and information with the client, and we develop a treatment plan that includes a case manager, treatment, a medication outline, perhaps some housing if that would be of assistance, because many of people are homeless when we first work with them, and then we monitor after the court order to be sure that people are attending appointments, taking medication, getting stable housing, staying out of the hospital, and it takes about a year for us to see a turnaround from a state where they may have been homeless, not taking medication, just coming out of numerous admissions to the hospital, to a period of stability, routinely attending appointments, taking medication, and having been in the community stable for a good period of time.
Well, that's great. You know, and one of the things, I mean, our viewers have heard us talk about this before. I mean, there really is a shortage of services as a whole for people with all sorts of mental illnesses. And one of the nice things about AOT, if you do have an order on you, is that you are kind of get put on the top of the priority list for the available services, including the housing services, like you mentioned, and the type of housing services that we advocate for that have the wraparound services to really fully advance someone's recovery, correct?
Yes. We have, in Albany, we happen to be very lucky. We have a number of agencies who offer housing, supervised housing, and a number of different levels of support within the housing agencies, from a 24-hour staffed community residence to an apartment where staff can come in on a daily basis and just meet with you for a few minutes every day, to certified apartments and step-down programs, on-site apartment programs. So we determined with the treatment team what level of care would be most appropriate and least restrictive for the person that we're developing the treatment plan for.
Well, and that's a very important point when you say less restrictive, because some of the critics of the program think that it's a bit of a impingement on civil rights, that is a restrictive program. But as you say, it's really less restrictive. Anyone who needs that full support housing, of course the goal is to get them independently and living on their own and giving them the extra guidance that they need, correct?
Yes. Yes. We start with an assessment of what level of care is most appropriate. Someone may need to start in a 24-hour community residence to learn the skills that will then allow them to live independently. Right.
So that's fantastic. And, you know, we also talked about, you know, medicine. I think one of the critiques, one of the critiques that people sometimes have, I think it's a little misunderstood, is the role of medicine, that they think the AOT order is just to push medicine on people. And obviously, adherence to medicine is a crucial point in recovery, but it's also making sure you're going to your doctor visits, your therapy, whatever, like you said, whatever type of services are deemed necessary. It just helps keep the people on track. And, you know, it's a bit of a misrepresentation to say medicine is forced on people.
Medication is an important part of the overall treatment plan. The goal is to help people with this core order and the support services outlined within the treatment plan to engage with treatment providers, with case managers, with the services that we believe can help keep people out of the hospital, out of jail, out of the legal system. Medication is a part of that. But that it's well within any prescribing psychiatrist's purview to develop what they feel to be an appropriate treatment plan and medication regime with their client,
Right.
even with a court order that might say medications are stated, other contingencies. The doctor still is able to work that out with the client.
And, something we talk about a lot at NAMI, and when we talk about the recovery process, is that we're kind of changing the way things look or things are, and really changing to a person-centered approach. I think, maybe 10 years ago, you just were labeled with a disease, and anyone who had schizophrenia was going to get treated the same way. But, now we're knowing with research and everything that what we're calling schizophrenia today, 10 years from now might be 20 different diseases. So, we really talk about looking at symptoms and people's individual case rather than giving them a label and everyone who has this label has the same treatment. And that kind of, like you were saying, goes along with the AOT too. You look at the person as an individual. Not everybody's recovery is going to be the same. Not everyone needs the same amount of support, correct?
Right. We have different levels of treatment care. We have a clinic once a week to once every 2-week appointments where you would see your psychiatrist once a month or every 3 months. We have PROS programs where you could attend groups every day, every other day, depending on what the schedule is based on what your own goals would be and when those groups are offered. So there's a range of treatment modalities available. There's the ACT team, which Christine is familiar with, which is its own unique treatment format out in the community. So yeah, we do an assessment of what would be the least restrictive court order treatment plan and go from there.
Right, and that's, you mentioned the ACT team in a minute. We're going to get to Christine and her story, but I think that's so important because just as everyone's set of symptoms might be different, everyone's circumstances might be different. Not everyone may have the resources to get to a doctor or get to a program, a PROS, or get to whatever the program might be. So having the ACT team come to them is very beneficial.
Yes, and again, the ACT team tends to treat people who had a history of not engaging with traditional treatment programs previously, people who may be homebound for one reason or another, and it's all about developing engagement and trust with a provider.
Right, and that's always key. I mean, in any sort of relationship, and this is something we tell people a lot too, no matter what the situation is, you're not always going to hit it off with your therapist or your doctor right off the bat. It is a relationship, and it's a very important relationship, and if you don't feel like this relationship is working, it's okay to seek another one and fit a doctor or a therapist that you kind of gel with. I think that's an important part of recovery.
I agree.
So once, a couple other technical questions, once someone's appealed for the order, I guess they would contact your office, and we'll give you, would that be correct?
If they've applied?
Well, the first step would be
the referral.
Right.
The referral, which my unit would receive within Albany County. We gather, we do the investigation where we request information from the facilities where people have been admitted, review the documentation to be sure that it meets AOT criteria.
Which is very extensive. I think that's another misconception about the program is that people say that, anyone can get AOT. It's an easy thing, and it's actually a very extensive process, correct?
It sounds easy on the surface. There's actually 7 pieces of criteria. Most people tend to think of only one, which would be 2 or more admissions or incarcerations in the past 3 years, 36 months. That could be fairly easy to me, but those admissions or incarcerations need to have been clearly related to noncompliance with treatment and or medication. The person has to have been diagnosed with a serious mental illness. So a lot of people who are 18, 19, or 20 who have just beginning the process or not yet having been diagnosed would not be eligible because they have yet to be diagnosed with a serious mental illness. They have to also be clearly unlikely to voluntarily participate in a treatment plan. So we, want to make sure that people have been given the opportunity to connect and engage. So we'll often try that before we go to AOT. We'll put a case manager in place and really put in support services to help them connect and engage before we say, okay, we need to.
It really is like a last resort in a lot of ways. It's when all other options have been exhausted that we go to that option. It's proven successful. So you said it takes about a year for the full program to be effective to kind of turn someone around. So is a general AOT order for 12 months, or how does that work? Is it individualized?
In the beginning, when Kendra's Law was first written, the first order could only be 6 months, and then when they rewrote the legislation, they did extend it to a year, because the research showed that it takes about a year, or at least a year, in order to see a very clear positive effect from the routine that gets developed throughout the course of the order. And they can be obviously renewed or stepped down to an enhanced service package.
Right. So, and while during that year, how often does like the case manager, they report to the judge regularly, or is it at the end of the year the judge gets a report?
Actually, there's a weekly monitoring process in Albany County. Every county has a different procedure set up. We have a meeting every week where providers that are serving AOT clients come to the table and report on attendance, medications, symptoms, stressors that may be happening, and it's a communication forum for providers around each AOT client to give an update and let us know how people are doing.
That's great. Keeps you busy.
It does. Yes, it does.
Well, that's great. So I want to turn my attention to Christine and learn a little bit about your story and your success. So can you give us a little background about, maybe when you were first diagnosed, the symptoms that you had, and what led to your kind of entry into the mental health system?
I've been suffering from a nervous breakdown since 1990. I was homeless in 2003, and I had a series of hospitalizations that were numerous. And I also have bipolar disorder. I have a bipolar disorder. I had a lot of hospitalizations throughout the years. I haven't been in the hospital for quite a while now. I've been stable thanks to this shot that I'm getting now. I get a shot every 3 months.
That's great. So, like you said, you've had multiple hospitalizations, and did you have, a loved one or someone suggest that maybe AOT was right for you? How did you end up having the order for AOT?
I'm not really sure. I was brought in a while back by my parents, quite a long time ago, and my family had looked around in, the hospital, asked them if there was any help for me. That was quite many years ago.
And that's the point. Is your family still involved in your recovery?
My mom is alive. Yes, she's 73.
Oh, God bless. That's all. We often say to anyone who's watched the show has heard me say this probably on every episode, that we really think that the recoveries happen best when the individual with the illness, the family member, and the service providers work together. So it's good to hear. Family involvement is so important, but obviously families can't do everything. So it's great that they were able to get you that extra help that you need. So kind of explain to us how the program has worked for you. As Ramona said, a lot of it you're getting your services through an ACT team. So can you explain how that works?
I meet with them on a weekly basis. I usually meet with them or 6 times per month, excuse me. And I see therapists, and sometimes they have classes. They have wellness classes there for the outpatients to go to. It has benefited me in a lot of different ways. And I just recently got a new place to live, safer and bigger place to live in than the efficiency apartment that I used to live in. They helped me with my housing, and recently I just got my driver's license back.
So they helped you with all those services. There's so many things that go into recovery that we don't even talk about. Like we said, I think a lot of times people focus in on medicine and therapy, but like you say, helping you get your driver's license back, helping you get the housing referrals that you need. Were there any other kind of supplemental services, just basic things that most people take for granted?
They helped me get on the WIC service and Medicaid, medical and health benefits, and WIC and or not WIC, excuse me, SNAP.
Right.
SNAP program. They helped me get my benefits. They give me moral support. They have a Christmas party once a year. It's nice. It's really nice.
And that's great. And since you had the order first, you said you haven't had any hospitalizations, right?
I've been clear of hospitals for going on, I think, 2.5 years.
Wow. And like you said, before that you were kind of in and out of
I was in a lot of hospitals for a long period of time. I kept having nervous breakdowns and suffering from depression.
I mean, actually, to be honest, like I said, this actually sounds a lot like my mom, to tell you the truth. You know, I remember when I was 17 years old, she had a nervous breakdown right in front of us, and we had to call, the ambulance and bring her in. And, she was briefly hospitalized then, but went to live with my grandparents. So, like I said, family help. At that point, I think it was before New York had Kendra's law. Well, actually, I think Kendra's law, 1990. 99, yeah. So this is 93. So, I wonder if, what helped. But, so like I said, family is so important. And it's important to show that people can recover given the support. I mean, thank God my mom's in a very good place now, and it looks like you are too. So the program certainly has been successful for you. What would you say to people who challenge the program and says it really, that maybe it impinges on people's civil rights or things like that?
If it's mandated that you have to be on medication by a doctor, you have to be on medication. I haven't had any complication with this shot that I'm receiving. I don't feel that way about it.
Right. It's interesting. I think even people might hear shots and think, oh, that's not the best way. But, I think for anybody, medicine adherence is a challenge. I mean, I have to take medicine myself. I have, from ADHD, and I have heartburn, just Prilosec, and my wife's always telling me, "Did you remember to take your medicine today? Do you remember to take your medicine today?" I think for anyone who has a big medicine regimen, adherence can be challenging, mental illness or not. I mean, I'm always in a rush. I'd forget my head if it wasn't screwed on, but that's a whole nother story. So the shot. It was chosen because it's just easier to adhere, obviously. You don't have to worry about taking the pills every day, correct?
I was losing my medicine a lot of times, too. A lot of times I had lost my medication and or misplaced it, and I didn't have the medication to take when I was hospitalized.
So, I hope it's not a difficult question, but, when you were struggling, where did you see your future? Or did you have hope? Or, where did you see, 5 years ago, let's say, where did you see yourself in 5 years?
Hopefully, I'd like to get back in the working field. I haven't worked in a long time. I haven't worked since 2003. And where would I like to see myself in 5 years?
Well, I'm just saying,
from now?
Do you feel like you have a better chance of that now than maybe you did 5 years ago? Do you see, have
I
your
hope so.
Yeah, so your
I hope so.
expectations through the program have changed. You can see yourself, taking those next steps. Now you're living independently, like you say, you got your driver's license back. So obviously employment and things like that are still realistic dreams for you.
Yes.
That's great. And that really the program and the supports that you continue to get. Now, are you still under the AOT order, or are you still getting your services through
Actually,
it?
Christine successfully graduated from the actual AOT court order and is on what we call a step down, which is the Enhanced Service Package, ESP, which allows us, it's a voluntary situation where Christine has agreed she'll continue to work with the ACT team and follow what was the treatment plan, and that allows us to continue to receive weekly reports to make sure that she's still staying good, and that's a 6-month. The ESP is a 6-month plan, so soon she'll be flying solo.
Free like a bird. Now,
although still with her treatment.
Right, and that kind of led me to my
Right.
next question. Once the AOT is expired or the step down's expired, could she still lean, or could anyone still lean on those services?
Absolutely.
So
That's
you're not
really the
abandoned.
point.
You're
No,
not
exactly, no.
I think that's a misunderstanding too. That people say
absolutely not.
they treat you for a period of time and then they,
No. It's just all we do at that point is to pull away the court order mandate, and we want you to stay involved in the services.
Right. I mean, we say this all the time, recovery is a day-to-day process with everything. Everyone's going to struggle and, and making sure the supports. You're never free and clear, of course. I mean, I tell you from my personal, both with myself and my mom, but you always have to work on things, of course, and knowing that support's always going to be there, and it's so important. So.
And that's what part of the weekly monitoring allows us to do, is if we hear that there are stressful events happening and they're affecting our client negatively, then we can increase the support services because we're around the table identifying and talking about it and saying, okay, we will do this, you will do that, and increase supports to help make sure that they have what they need in order not to go back to the hospital and to stay stable.
Okay, that's great. Now, as we said, it's very hard. We talked about how extensive the process is to get an AOT order. So I'm going to ask this question to both of you. We have a helpline at NAMI New York State. I think a majority of the questions we get are about people who are worried about a loved one, whether it be a sibling, a child, a parent, a spouse, and they would never qualify for AOT. They haven't been hospitalized or whatever the case may be. I'm kind of interested in both of your opinions on this. How would you suggest that person who's concerned about a loved one communicate that you're afraid you think the person might need help, especially if the person doesn't think they need help? A lot of times when people are in the midst of their illness, they don't realize they're ill or they don't think they need help. What would you tell people that, they wouldn't qualify for AOT, but how would you encourage them to get their loved ones to get help on their own?
Well, it does depend on the services that are available in the place where you live. Albany County does have a mobile crisis team. Albany County does have agencies like CDPC and Equinox who have family support services and resources. And that's been an avenue for family members to start with family support services to gather information. And most of those services will come into the home, explain services and resources to the family member, and let them know what options exist. They would have to be willing because it's a voluntary situation, but the more information one has and about how to access services, I think the more opportunities there are to accept them.
Right. No, I agree. I know a little bit too, like I said, for my personal, I'm going to turn to Christina in a second. I remember when I was struggling, I was diagnosed with ADHD very young, 5 years old, and then, you think you're over it. And, I remember in high school I was struggling and even early in college, and I didn't want to do therapy. I didn't want to take medicine, and my mom, we would clash on that, and so I know from the inside how it could be tough, and then you realize, the best thing I ever did was go back and get the therapy and get the medicine. It's helped me, and really all I was hurting was myself. So that's one way I like to tell people that by not getting treatment, you're really just hurting yourself. We want so you live a full life. So what would you tell someone in your position who may not want to get help? And
I would try to explain to them there's nothing you can't lose out. Give it a try. It can't hurt nothing.
Right.
It's helped me out a lot because I had no support. I had no one to talk to. Give it a try.
Right. Well, that's the point. And I applaud you so much, both for your recovery and all the work that you've put into it and being here today. It's never easy to come and tell your story and be open. And I can't tell you how much I appreciate you coming and telling your story, being honest with us, and just, we say it all the time here. You've heard me say it already at the top of the show, that hope starts with you. It's a saying we use at NAMI a lot. And I know people seeing you today, you're going to provide a lot of hope to people that recovery is possible. So I really thank you so much for coming today and telling your story and sharing with us. It's really going to help a lot of people.
Thank you for having me.
Oh, well, it's so important. And like I said, just we really have a lot to do to spread knowledge and information on this issue. There are so many misunderstandings about it. And let's check here how we're doing. Okay, and we do have a bill that's in front of the Assembly right now. It's 1275. It would make the law permanent and do some enhancements with it, which we're excited about. Add family education to judges and police and law enforcement, and we're excited about that. In fact, we spent all day advocating for that bill today, so hopefully that will pass. It's passed the Senate, and we know the program works. We know it's been successful. Christine's been a fabulous testimony to it, and I thank you, and thank you for all the work you're doing, Ramona, to help people. It's really, you're making such a difference, as the statistics show. So thank you for joining us today on Mental Health Now and exploring this important topic with us, and we'll see you next time.